This has been an extremely informative discussion. Before we end, I'd like to closing comments from each of our panelists. So, Traci, we're going to let you lead off.
I would just like to thank you. Always in these types of situations, I learn something new. I think in the next 5 to 10 years, certainly enhanced recovery is going to be the gold standard of care, no matter what type of surgery that you are having. And I think the important things to consider if you are a hospital, an administrator, a surgeon trying to implement this is that it really needs to be concerted effort. You need to listen to all those involved so that each person feels like they've contributed to the protocol and are going to be much more likely to follow it. And then with that, just needs to have close follow-up of compliance and frequent monitoring of the outcomes.
Great, thank you. Sanjay?
Well, I think a big thing to consider is there's no I in team. I think it's not just a surgeon or not just an anesthesiologist. It's a whole group of healthcare providers, not just physicians. And so really starts off with the surgeon, the anesthesiologist, pain specialist, nurses, the patient themselves, even physical therapists and nutritionists really all come together. And I think that when you're trying to develop a protocol at your institution, if you don't have one already, the first thing is you got to get everybody in the room and you got to talk about it. You can talk about it all you want, but you can, once you get something on paper or something formalized, then it'll really come into fruition. And after that happens, you should revisit it, periodically check up on things every 6 months, 3 months, however, whatever you think, to fine tune it, make adjustments, because no two institutions are the same. You can't get everything the same way. There's no cookie cutter aspect to this. And so I think those are important things to consider.
Declan?
I think that there are so many components to ERAS that can be implemented. You have to look at your institution and decide what can we do. It might not be that each hospital or each group can do absolutely every one of the literally dozens of potential interventions. You have to look at what's possible to do, because I think every one of these things has the potential to really contribute positively to patient outcomes. And one other thing, I can't emphasize enough how important it is to make the patient feel like this is not something that is being done to him or to her, but that it's something that they're participating in, and that they really have the ability to influence their outcome by embracing doing this. And a lot of that is about understanding that maybe the best way to manage pain isn't just to get narcotics. If people come in with the expectation that that's not the only way to take care of things, that really helps.
John?
I'll echo Traci's comments. I appreciate the chance to be here in this discussion. I always learn a lot from these discussions as well. I think the exciting thing to me about this ERAS discussion in general is that it's, the conversation is going towards person-centered care. We had patient-centered care not too long ago, and nobody wants to be a patient, so let's center the care around the person. And we're coming out of an era where it's system-centered and anything but the person. So this is exciting to me. I think ERAS is a articulation of evidence-based best practices centered around the person. And to Declan's comment earlier, this should be expected recovery, not enhanced recovery. So I think we need to apply it to all of our patients going forward as best we can. Our care should be varied based on the person's history, not the fact that we train in different places. So it is different every place we implement it, but the principles should be the same, and we should drive that direction, I think.
Those are all fantastic comments. So thanks for all your contributions to this discussion. I think it's been great. It's been a meaningful discussion, especially because of the fact that we've got, again, multiple specialties represented here. On behalf of our panel, we thank you for joining us, and we hope you found this peer exchange discussion to be useful and informative. Thanks so much.